I think this evening is a very timely event, not least because I'm sure we're all aware of the rising numbers of those that are suffering with mental ill health. And certainly amongst the student population nationally, we're aware numbers are very much on the increase. And our own student union has made it a priority by running its own mental health campaign this year in order to support student wellbeing and mental health. So what of the relationship between psychology, religion, spirituality and mental health? Is it the perfect mix or the perfect storm? How can spirituality and faith be helpful in improving mental health and well-being? And I'm delighted to welcome our guest speaker, Professor Patricia Casey, who will unpack this topic for us and share her insights from her studies in this field over many years. Professor Casey is a consultant psychiatrist at the Mater Misericordiae University Hospital Dublin and holds the position of Professor of Psychiatry at University College Dublin. She studied medicine at University College Cork and since graduating has developed a special interest in psychiatry and research training here in Britain. Her clinical and research interests include depression, personality disorder and suicide prevention. And among many accolades, in 2007, the Dubliner magazine listed her in the Good Doctor Guide. I'm sure the highlight of your career, but nonetheless a worthy point to raise and to take note of. She's a regular commentator on a variety of social issues and is known for her regular column with the Irish Independent newspaper. So without any further ado, would you join me in welcoming Professor Casey as she comes to speak to us on the topic of religion, spirituality and psychological well-being.
Thank you very much, Matt. If you knew the kind of journal the Dubliner is, you wouldn't be talking about it. Now, how do I move the slides? I presume I do it with the mouse, do I?
Should be able to just right with the mouse. Yes, just clicking on. Click on that one.
Right, okay.
Would you prefer that or the keyboard?
No, this is fine. Okay. This is easier. Thanks very much indeed. Well, thank you all for coming along this evening. It's lovely to be here in a town and a campus like this on a spring evening, a mellow spring evening. It's like something from a P.G. Wodehouse novel. It's wonderful. So thank you for inviting me to be here, and thank you for the introduction, Matt, and for chairing this. I'm going to talk on the title there that you've got, religion, spirituality and mental health. And the aims, there are several aims. The first is to explain what we mean by spirituality these days. It can be absolutely befuddling when you delve down into it, so I will talk about that. I'm going to discuss the relationship between religion and mental health. In particular, does religion help mental health? Is it neutral? Does religion harm mental health? And what do the international studies say on that? I will also discuss briefly some biological findings. And you might remember a few years ago there was a lot of talk about the God spot, that somebody had identified a part in the brain where God resides. And because it was a part in the brain, it was just a brain thing rather than a God thing. I'm going to discuss that, and I'm going to discuss some of the myths about religion, in particular the myths about Roman Catholicism, with which the Roman Catholics here are all too familiar. This talk isn't going to discuss the existence of God. And it's not going to look at various faith traditions, although there is an emerging literature on different faith traditions and how those can influence mental health as well. Most of the studies to date, as you can imagine, have been done on the Christian tradition, and particularly done in North America. With that in mind, this is, if any of you are interested, this is the title, one of the many titles of a book by Harold Koenig, K-O-E-N-I-G, and he's professor of psychiatry and religion at Duke University in America, and he has written many books on the topic, including a handbook of health, which is 2,000 pages long. This one, Religion and Mental Health, is specific to what I'm talking about today, and you can download it. That's where I've got the page rather than the book. I downloaded it from the internet the other day. It's about $60 or something like that, and so I downloaded it. So Religion and Mental Health Research and Clinical Applications, and as I say, it's easily accessible, and it contains a lot of this information that I'm going to talk about. This was a sign, an advert that appeared on the buses a few years ago. I remember seeing them in London. Does God exist? Yes, no, probably. I thought it was actually okay myself, because at least it allowed for some people who were having doubts. It wasn't taking the view that people's opinions on the existence of God was binary, that it was a simple yes or no. There are many people who fluctuate in their belief in the existence of a personal God. So I thought it was okay, but it did create a bit of a rumpus. I suppose buses shouldn't really be asking philosophical questions. It's not exactly the right forum in which to consider the afterlife and such weighty matters. And of course we all know about the God delusion. Now psychiatry doesn't have and hasn't had a very easy relationship with religion at all. The best known psychiatrist ever, Freud, said that it represents a defense against childish helplessness. Such infantilism must be surmounted. And Dawkins, of course, who isn't a psychiatrist but claims to be a scientist, described faith as a delusion. And then other writers said that sophisticated nations did not require a religious orientation, or Durkheim implied the same thing in the elementary forms of religious life. Insofar as psychiatrists have had a sort of a negative view of religion and faith, and I must tell you a story about this. I edit one of the journals at the Royal College of Psychiatrists, and a few years ago I got Harold Koenig, the man who wrote that book, to do a piece on the role of religion and faith in modern psychiatric practice. And he, writing from an American perspective, he said that on some occasions it is okay to pray with patients. Very occasionally, he said, but on some rare occasions it is. I have never done it personally. But one of the senior people in the Royal College of Psychiatrists took umbrage at that, and the special interest group in spirituality had to organise a special conference to address the issue. So there was a conference at the Royal College of Psychiatrists because this man, this psychiatrist was so astonished and so angry and so horrified at what was said that this conference had to be called. The whole thing simmered and then died down. So even though psychiatrists have a jaundiced view of religion, the opposite is also true. Many people with mental health problems and their families, and indeed many people of a religious orientation, have a very negative view of psychiatry. For many centuries, mental illness was viewed as in some way being tied up with the devil and demon possession. And in the early church, well, not even in the early church, in the medieval church, exorcisms took place to cure mental illness. To this day, this kind of language is used. We hear of people with mental illness fighting demons. That's very much tied up with a kind of a religious view that mental health problems are essentially religious problems. In my own work, I've treated, as you can imagine, many priests and nuns, and they're enormously difficult to treat because they will not take medication when you want them, and they view medication as being something external to them, and because their symptoms, and the symptoms religious people have when they become maybe depressed or anxious, are that they can't pray, they feel isolated from God. In the same way that a secular person would feel isolated from the social media, and they wouldn't be engaging with it, they wouldn't have any interest in it. So religious people disengage from the elements in the world that they normally would be engaged with, and they won't take therapies that they know would work. As a result, some religious denominations, particularly some of the very fundamentalist Protestant denominations, will not sanction or allow or approve of people seeking psychiatric treatment, and instead have developed religious therapies and pray over people and such like. And so many people regard mental illness as lying in the domain of religious experience or evil or wickedness. That is, of course, not my viewpoint at all. But most people, though, most people see mental illness as something that needs treatment from mental health professionals, usually psychiatrists. Now, to come back to the people who don't believe that progressive nations need religion, or that, you know, all the people who adhere to religious beliefs and practice religion are swamp donkeys and rednecks, and, you know, have all of those attributes that anti-religious people use, epithets that they use to describe us. Almost more than 2/3 of Nobel Prize winners were practicing some faith, some denominational faith. If you look at the composers, this is just a few of the ones that are currently alive or that have very recently passed. James Macmillan is probably well known to all of you. Goretzky, John Taverner, the singer Bocelli, and the very famous Polish composer, as well as Goretzky, Penderecki. And then among pop and rock singers, Alice Cooper, Bob Dylan, Nick McBride from Iron Maiden, Sufjan Stevens. They're all practicing Christians. And again, well-known writers, Lewis, Graham Greene, Flannery O'Connor, Tolkien, Elmore Leonard, Shoshaко, Endo, P.D. James, and Solzhenitsyn. And these are just a few that I picked out of my head. So you don't have to be an ignoramus or an uneducated person to be religious as some of us would be led to believe. Now, to come back to, I said at the outset that psychiatrists are hostile to religion, traditionally have been hostile to religion. There's been a bit of a shift in recent years, and this is a quote from a policy document of the Royal College of Psychiatrists in 2013. It says there's an extensive evidence base in support of the relevance of spirituality and religion in understanding the etiology of many mental disorders, the benefits of considering spirituality and religion within an overall clinical assessment of the patient's condition. And they go on to suggest that religion and spirituality should be considered as components of both psychiatric training and continuing professional development. By the way, these slides are available if you want to take them away, or if you want to give me your email address, I'll be happy to send them to you. So that's the current position of the Royal College. So from having once said that it was something that infantilized people and should be surmounted, here is the Royal College up the road in London saying, no, we need to take it into account. The American College of Psychiatrists takes a similar view. And the General Medical Council, to which all doctors in Britain are answerable, they mention it in assessing a patient's condition. You should take account of spiritual, religious, social and cultural factors. It may therefore be appropriate to ask a patient about their personal beliefs, including their religious beliefs, but they must not be pressured to discuss them or to justify their beliefs or the absence of them. You talked about a journal at the beginning, Matt. There are a number of journals specifically devoted to religion and mental health. Before I come to them, though, the reason that there are now a number of journals devoted to it is because there has been a dramatic increase in the number of papers devoted to religion and mental health, scientific peer-reviewed papers. And I did a very simple search on Medline. Medline is a search engine that doctors use to access the names of scientific papers in medicine. And between 1993 and 1999, when I put in the simple terms religion and mental health, I got 142 papers. Over the next 6 years, 363. Then for 1 year alone, 80, 2009, 94. For 2011 up to the end of November there were 83, so that would probably have been about the same as 2009. For 2018 there were double that number, and up to February the 1st this year there's already 15 papers. I actually meant to put it in. I did a look up to the 1st of March and there were 28 papers. So a lot of papers and a huge increase in papers, and with that an increase in the number of journals. There are 6 journals, and the numbers after them are journals that are what we call impact factors, that measure the importance of these journals to the area that they're functioning in or operating in. So there they are, 6 journals there. There are 2 major controversies in the field. The first is, what is the role of religion in relation to mental health? Does it help mental health? Does it harm mental health? Or is it neutral? So does it have a causal role? Does it act as a direct causation of good mental health? Or is it just vaguely associated with it? Let me give you an example of the difference between association and causation. We know that we don't know. Supposing somebody said to you, people with more knowledge take bigger shoe size. It's a ludicrous thing to say. But when you think that older people, as people get older, they get more knowledge, and as they get older, their shoes, for children, as they grow older, they take bigger shoe size. So it's actually to do with age rather than to do with actually having more knowledge. So what seemed like more knowledge needing bigger shoes and causing bigger shoes, a big brain maybe causing your feet to grow more. It's to do with the fact that as you get older, through childhood, you learn more, and so it's an association rather than a causation. And that's important. So when you get into discussions with atheists about religion helping mental health, they say, well, it's not religion really. It's to do with the fact that if they go to church, they make friends at church, and they have social contacts that they get to know, and that's what helps mental health. And having coffee mornings, you'd have the same effect if you joined a knitting club or a mother and toddler group or a rugby club. It's the same kind of thing. It's not to do with God at all. It's to do with associated things. So that's one of the second controversy is between religion and spirituality, and I will deal with that in just a moment. Now, we can only know that one thing causes another thing. So we can only know that smoking causes cancer if we have a means of exposing the person to it, or that the tetanus virus causes tetanus, or that eating too much causes obesity. We can only know those things when you can expose somebody to it and test that. And you have to you can't do that with religion. You can't make people believe in God to test whether it's the belief in God or something else. So there has to be a way of doing that. And with cancer, it was difficult. It was argued for a long time that it wasn't really smoking that caused lung cancer specifically. The opponents, the cigarette companies would say, no, it's other things. It's that they're living in a polluted world, or they're eating the wrong kind of food. It's nothing to do with smoking. And One of the men who worked on the project to examine the relationship between smoking and lung cancer in particular was a man called Bradford Hill, and he was an epidemiologist. An epidemiologist is somebody who studies the frequency of diseases and their causation. And they look at prevalences of and incidence of things. So they talk about things like the prevalence of a disease or the incidence of a disease, and they can tell from that kind of information what's caused it and what's not. And Bradford Hill, knowing that there was this problem with cigarette smoking and and lung cancer, said, look, we can't actually prove it directly because we can't randomly allocate people to smoking cigarettes and to not smoking cigarettes. That would be just immoral, that would be unethical. We have to look for other ways. And he developed what we call Bradford Hill's criteria of causality. And basically what they rely on, the first thing there must be is that there is a time relationship between the thing you're exposed to and the thing that it causes. So if you want to prove that religion improves depression, you have to have religion preceding the onset of the depression. And you have to demonstrate that in all the studies. The strength of association. The greater, and association is a statistical measure of the strength of the connection. So the higher the strength of the connection, the more likely it is to be caused by the thing you're looking at as causing it. The more of the thing you have, so the more religion you have, the more likely you are to have good mental health. The less religion you have, the less likely you have. That would be the way it would work. And you can look at that as an association in your studies. Consistency, it has to be replicated, not just in one centre, it has to be replicated in different studies. Plausibility, there has to be a mechanism that can explain the causation, and a sensible mechanism. Unlike the shoes and the knowledge, which isn't a sensible mechanism. There has to be a sensible mechanism causing it. There have to be alternative explanations that you consider and rule out. It has to, if you can take a specific group, so for example, if you were interested in the effect of religion on mental health, you might take a group of nuns living as hermits up in the mountains in France somewhere and follow their mental health and other things, and that actually has been done. There's a book, the name of which escapes me at the moment, called not the God Brain, but something, it'll come back to me, where he actually studied nuns at prayer by rigging them up to EEG machines and that kind of thing. Anyway, that's the specificity. Experimental amelioration, that means by giving a treatment. So if you can develop a treatment in the case of religion and mental health, when people who develop mental health problems, and offer them a religious intervention, a tested evidence-based religion intervention, and there are, if you get this book, you will learn about the religious-based cognitive therapies. If you can provide those and it demonstrates an improvement, you can infer possible causation and coherence. The epidemiological studies and these kinds of studies have to link into biological and other kinds of studies as well. So you have to go, if you can't randomly allocate people to and expose something you expose them to, you have to go through all of these processes to get to the stage of arriving at causality. I had an email conversation the other day with Harold Koenig, who's the man in the world who knows most about this stuff, and I asked him if we were nearly at the state of saying that religion definitively causes good mental health rather than that it's associated with it. And he said, well, we've got some religious-based cognitive therapies on the way, and so that's the last step we have to prove in the Hills criteria. So we're nearly there, was his answer to me. So that's good news. Now, I want to come to religion and spirituality. We always think of religion and spirituality as being intertwined, very closely intertwined. But that isn't the case anymore. And particularly when you read some scientific research that's been done on this, it's very bamboozling. A major change away from an interest in religion towards more of an interest in spirituality happened in the 1960s. Now, for people of various faiths and a personal God from different religious traditions, they would have said, oh, that's very good, because that's making us be more introspective about ourselves, more trained on the afterlife, more trained on the supernatural. It's a very good move. It's a more profound experience of God we will arrive at, rather than by superficially being religious and simply going to church as a kind of as a habit. But in fact, that was completely wrong, because what happened was, firstly, there was a sexual and social revolution at the time, during the 60s and 70s, where people were turning away from institutions, including the formal institution of religion and church going. Secondly, and this applied particularly to the Catholic Church, and I think it may have had knock-on effects onto some of the other Christian churches as well, although obviously less so than the Catholic Church. The sexual abuse scandals are absolutely devastating to formal religion, particularly the Catholic faith. And then there was the book in 2001 that sort of mopped it all up together, called Spiritual Marketplace, Baby Boomers and the Remaking of American Religion. And I'll be coming to that in just a moment. This is taken from one of Harold Koenig's papers published in the Canadian Journal of Psychiatry in 2009. And it's a very nice description, I think, of the move from spirituality towards the concept of spirituality that now embraces everything, but is no longer the spirituality that peoples of religion would identify as being spiritual. And here we have, and when I send you these slides, if you want them, you'll be able to see it a bit more clearly. Here we have religion and spirituality were the source of everything. Spirituality was at the center, and they were both religion was really an extension of spirituality. It was, I suppose, more to do with the actual visible practice of spirituality. And that was different from secularism, very different. But they all had an impact on mental health and physical health. And then over time, religion became the central thing, and spirituality was beginning to become wider than just religion and the personal God. It was expanding, but still different from the secular. Oops. That feels like I'm being interrogated. And then down here we have a further development where spirituality began to engulf everything, including some mental health issues. And I'll come back to that in just two seconds. And then religion was still there, but much less relevant. And then that was still different from secular. So people were secular, or they were spiritual or religious. But spiritual was enveloping personal feelings of connectedness and well-being and purpose, the kind of thing that you would get if you probably took a joint or took some LSD. These feelings of connectedness to these outside, what's the word I want? Emotions. And then down here at the bottom, we have spirituality literally engulfing everything, both the religious and the secular. And everybody is spiritual. And it's Roof who was responsible for that. And I remember in or around the time that book came out, I was reading a review of it. I was sitting at home in Punchestown, in our home, in front of the fire, and I read the book, or I read the review, and it said, the headline was something like, "Spirituality at last is for everybody." And I thought, isn't it wonderful that everybody is becoming so spiritual? Until I read down to the next paragraph, and I saw that it had nothing whatsoever to do with the spirituality as I understood it. And so that has led us now to, when you ask somebody, are you religious? Nobody says they're secular anymore, by the way. Very few say they're secular. They say, no, I'm not religious, I'm spiritual. And so they might be as wanton and as self-indulgent and narcissistic as anybody was ever made, but they'll still tell you they're spiritual but not religious. I remember travelling, I was on one of my many flights back from London to Dublin one evening, and I had some book about spirituality and religion. I was reading it, and this very pleasant woman who was sitting next to me started chatting, and she was going over on business to Dublin, and she said, I'm not religious, but I'm spiritual. And I asked her the question, I said, what do you mean by spiritual? She said, well, what goes around comes around. And I thought, oh yeah, I said, yeah, I see where you're coming from, sort of, left it at that. And this is the World Health Organization definition. Now this is important because this definition of religion and spirituality is taken from a questionnaire that, in the instructions for the use of a questionnaire that's widely used in religion and spirituality research. And it's used in a lot of scientific papers. And if you read it, you will see how broad and vague it is. And this is the problem. It says the following questions ask about your spiritual, personal or religious beliefs. These questions are designed to be applicable to people coming from many different cultures and holding a variety of spiritual, religious or personal views. Alternatively, you may have no belief in a higher spiritual entity, but you may have strong personal beliefs or feelings, such as beliefs in a scientific theory, a personal way of life, and some others. While some of these questions will use words such as spirituality, please answer them in terms of your own personal belief system, whether it be religious, spiritual or personal. So you can see how broad that is. It says here you could have holding a variety of you may have no belief in you may have strong personal beliefs or following such as beliefs in a scientific theory. So if I believed that the earth was flat, that would be a spiritual belief or a religious belief according to this questionnaire. If I believed that the aliens were going to join us fairly soon, that according to this questionnaire would be a religious or spiritual belief. And this questionnaire is used in loads of scientific studies being conducted in this area. So if you're reading something in a newspaper or a magazine about religion and spirituality, see if it tells you what questionnaire they use. And a lot of the questionnaires in current use are using this one. And there are others like them as well. Now, what's the evidence about spirituality and religion based on the person answering the question about spirituality in terms of their own beliefs? Which has the greater influence, being religious or being spiritual? And the evidence is that it's actually being religious. And this comes from a number of studies, but I've just put two up here to illustrate them. One by Mike King, done in 2006. There was no CMD stands for common mental disorders. So if you had religious beliefs or these spiritual beliefs or no beliefs at all, there was no difference in the prevalence of common mental disorders. But when they specifically separated the religious and spiritual group, the religious group had fewer mental health problems compared to people with no religious beliefs, and the spiritual group had more compared to people with no religious beliefs. So religion in that study did give some protection. Yeah?
Sorry if I missed it right at the beginning, but do you mind just saying what the difference is between spirituality and religion?
Well, it's what I've been talking about in the last section, where it can mean anything you want it to mean in the questionnaire. You answer it according to your own understanding of what spirituality is. It's not spirituality as a religious person would understand it. It's your own view of what spirituality is.
And how do they separate it then?
Well, that's the problem, and I'll come to that in a moment. Now, in this they did, because they were able to separate the questions, the vague questions about spirituality. But if you lump them all into one, and don't take care to, if you code only. This is done by a coding system. You have numbers, you get a total score, and unless you get a separate score for the spiritual and religion components, you won't be able to do it. But really, you shouldn't be asking the questions about spirituality using this, because it's not helpful. And Rasic similarly did the same thing, although with a different questionnaire, and this is called the Journal of Affective Disorders, GAD, in 2009. Identifying oneself as spiritual was not significantly associated with a reduction in self-harm after social supports were controlled. And the importance of controlling for that is that we talked at the beginning that people say it's not religion, it's the social supports and the friends you'll make through religion. So you have to control for that in your statistical analysis. But they did find that identifying oneself as religious, i.e. attendance in church, was significantly associated with a reduction in self-harm after social supports were controlled. So that's one. There are two studies that separated out spirituality and religion and found that using the new concept of spirituality, it actually made things worse or was neutral, whereas religion, defined by religious attendance in church, positively helped. Now, one of the things people who are religious engage in, and it's probably part of the mechanisms, one of the mechanisms for religion helping people when they're going through a mental health difficulty, is they engage in religious coping. And there's positive and negative religious coping. And there's a writer, a psychologist called Pargament, who in 1988 first talked about positive and negative religious coping. And positive coping is obviously different from negative coping. Positive coping occurs when you take joint responsibility for your illness and for getting better with God. You do it jointly with God. You're not sitting back passively and praying, just praying for it to happen. You're actually corroborating with God. You're praying to God to give you guidance as to what you should do. You're engaging actively with medics or whoever is treating you. Secondly, you self-direct yourself. I suppose that's the same really as the corroborative model. Yes, you accept that you have a role in that God has given you agency over yourself and that you have responsibility for it as well. So if, for example, you've got high blood pressure, hypertension, and you're, say, obese, you don't just pray that God will lower your blood pressure. You accept that you have responsibility for yourself. You engage with the doctor. You hopefully accept that God has directed. The doctor has guided the doctors, has given them a brain, has given them the wherewithal to study and to acquire the skills they have, and you yourself collaborate with that. And God has given you agency. You have a role in that yourself. And as you don't defer your actions, you don't pass responsibility completely to God. You seek help. Now, a lot of we'll come back to prayer in a minute, because a lot of atheists would say, but your praying is something passive, you're not doing anything. Actually, if you're praying from the heart, you're doing something. It's not visible to others, but you are doing something. Now, turn to the areas that have been studied in relation to mental health and religious practice. Virtually every area has been studied. I'm only going to talk about a few of them here because there are just too many. Depression, anxiety, schizophrenia, bipolar disorder, marital stability, delinquency, crime, bereavement, adolescent risk-taking, longevity, and then various physical conditions like recovery from surgery, wound healing, heart attacks, IVF, and pain tolerance. So a gamut of areas of mental, psychological and physical areas have been studied. Now, in depression, of the studies that have been examined, 61% found that the practice of religion lessened either the prevalence of depressive disorder in community groups. There's about 4 years ago, one with about 28 subjects. There were nurses in America were studied, and those who attended church more than twice a month were compared with those who attended less frequently or didn't attend at all. And they found that that there was a significantly lower prevalence of depression in the attendance group than the non-attendance group. There was a systematic review stroke meta-analysis done in which all the quality studies were analysed together. The studies were selected on the basis of their good methodology, their good statistical analysis, and pooled together and analysed as one. It's a standard technique in medicine for, when you look at one study and another study, when there are 50 studies, you don't know which ones to believe. You can actually pool them all when they meet certain criteria. And that's where the 61% figure comes from. That was a meta-analysis. I think it was 2008 by Becker. And so they found that the prevalence of disorders or symptoms reduced compared to controls, and when they were receiving treatment, they found that the practice of faith aided treatment when compared to those who were getting to control groups or getting standard treatment. So the addition of examining the addition of faith practice improved the outcome. In anxiety, similarly, 49% described or were identified as being there was a 49% less risk of anxiety in people who were practicing faith regularly compared to those who weren't. I'll be coming back in a moment to bereavement. Interestingly, in schizophrenia and bipolar disorder, there's less evidence for the benefit of faith. Although those groups, the groups with those very severe mental health disorders, use religious coping very much more so than their doctors realise. And then the psychiatrists realise about 60% of them use religious coping. They pray a lot and they engage in religious practice. But the evidence that religion actually reduces symptoms or reduces the risk of developing these conditions isn't there. I'm not going to talk about any of the other ones. So the benefits, this is religious practice. To summarise, the benefits have been identified in many studies. Lower risk of suicide and depression. Now, how does that work then? Is it due to the hope and meaning that religion provides? Is it because of lifestyle, a lifestyle guided by religious practice and injunctions? Is it support from the faith community, the book club thing? Now, in the studies that we've looked at, mostly they're now controlling for social support so as to remove that as a factor. Although it has to be said that it's highly likely that the social support one would get from a religious community are very different from the support one would get from your local rugby club or knitting club. So it may be that it's a different kind of support. Suicide. We do know that the risk of suicide is reduced very significantly in religious groups. This is a systematic review published by Koenig himself, and they found 68 studies examining the relationship between suicide and religion, and there were fewer suicides in terms of total numbers, and there were fewer suicides among the religious group when they followed them up, there were 59 studies showing fewer suicides in the religious groups. There were 2 that showed mixed results and 9 that showed no relationship. So again, here when we looked at suicide, the overwhelming majority of studies have found there's a reduction in suicide in people who are religious, and this is based on studies of these, and some were Canadian and some were from North America. And it's been postulated that this is probably due to the injunctions against suicide, to meaning, possibly to a supportive community. There's one study, Dervick, suggesting that religious communities provide support to people, and that protects them, helps protect them against suicide. There are myriads of papers on grief and religion. There's one systematic review, 32 studies involving 5,700 subjects. It's huge. And 94% described benefit from religious practice during bereavement, following a bereavement. And how might that be? It might be that the person reframes the loss. We'll meet again. You know, Christians believe that if you lose somebody, you'll meet them in the afterlife, and that's a comfort. Or they say he or she is in a better place. Or sometimes they reframe the suffering as making them more compassionate, and in becoming more compassionate, they can help others. So that's another way of reframing that I should have mentioned. I have it here under suffering. They also see suffering as perhaps having a purpose that's unknown to us. That's a very religious way of reframing suffering generally, or one's own suffering. Or comparative exploration, you see that somebody has suffered and is suffering, or you're suffering, and then you say, well, there's somebody else who's worse off, who's suffering in a worse way, and that in some respects can be helpful, and you pray for them, and that it increases compassion. There are a few, I'm nearly finished now, there are a few religious studies that are very interesting, a few biological studies that are very interesting. This is a study published in the British Medical Journal in 2001, and it took two groups, a group who recited a mantra, three groups, a group who recited a mantra, a group who recited the rosary, and they were Catholic, and a third group of controls. And they had to sit in a quiet room reciting their mantras, reciting their rosary, or thinking whatever thoughts they want. And they found that compared to the control group, the mantra group and the rosary group had good things happening to them physiologically. They had a reduced respiratory rate. The heart rate was sensitive to changes in blood pressure, which you want. That's a good thing. And overall, it reduced the heart rate as well. So that suggested that repeating something. Now, if the control group had been repeating expletives, who knows what that would have done, you know? One assumes it may not have had this effect, it may have had the opposite effect of making them angry, and, you know, but who knows? But anyway, so that was one study, and that suggests that some religious activities like prayer, particularly repetitive prayer, are help physiologically. It's probably why counting sheep helps you to go to sleep as well, you know. Now, in all of these things, it's been found that only certain, even within the so-called religious group, only certain people will be helped. And this was written about by a man called Allport, and it's been found in other studies as well, in his book The Individual and His Religion. And he talked about what's called intrinsic religious orientation and extrinsic orientation. And as you can imagine, intrinsic orientation is directed towards God. It internalizes the ethics and the practices and the beliefs of the faith one is living in. Whereas extrinsic orientation refers to the people who profess religious beliefs, but for reasons of convenience, appearing respectable, to gaining social advancement because of convention, but they don't actually internalize the conduct or the beliefs of the faith. So, some of the questionnaires do attempt to flesh out the difference between extrinsic and intrinsic for statistical analysis and exploration. Okay, no, let's just move on. Right, I want to move on to the last few slides, the last one on the physiology of this. Prayer and pain tolerance. In this study, 12 Catholics, this was published in a journal called Pain in 2009, and 12 Catholics looked at a Sassoferrato Madonna, and 12 agnostics or atheists looked at a Vermeer. And their pain threshold, they were exposed to pain, threshold was tested, and their brains were subject to an MRI scan at the same time to test their pain threshold. And this is the Madonna, and this is the lady with the ermine, the two paintings. That painting was chosen because it was broadly similar to the other one, to the Madonna. You know, they're gentle looking ladies, they're very pleasant to look at. There's quite a bit of blue there. Okay, and what they found was that in the group exposed to the Madonna, no, what they did was they gave the people, the Madonnas, the Catholics, the Madonna, and the Vermeer to the atheists. And they did their tests, you know, they, I think, picked their hand with a needle or something like that, and measured and then they swapped them around so that the Catholics got the Vermeer and the atheists got the Madonna. And what they found was that there was the only group that had a reduction in pain threshold and were therefore better able to tolerate pain were the Catholics looking at the Madonna. The Catholics looking at the Vermeer didn't experience that at all, only the Catholics looking at the Madonna, whereas the other groups, the atheists, whether it was the Madonna or the Vermeer, it had no effect. So even though they were looking at a very pleasant, you would have thought, restful, beautiful looking woman, it didn't do anything for the physiological and neurological measures that were being examined, and that suggested to the authors that the Madonna was looking at the Madonna was reaching areas of the brain, higher areas of the brain that ordinary beauty didn't reach to. Hence the idea of the God spot. That's the God spot. Okay, I'm just going to talk very briefly, last two slides, some of the myths, particularly about the Catholic myths. Right, one of them is that Catholics are excessively guilty, especially about sexual matters. That may have been the case a number of years ago, but as a psychiatrist who has probably more access, only slightly less access to people's innermost thoughts than the priest in confession does, it's not my experience that Catholics have too many hang-ups about sexual matters anymore. So I don't buy into that. I think that day has passed. One of the more often repeated and pertinent ones probably is people saying that guilt is negative and it's bad for mental health, and we must get rid of guilt. It's not good for you. I think that's mistaken. I think guilt can be bad for you, but more often than not, guilt is good for you because it points out your transgressions to you. So if you feel guilty about something that you've done wrong and that you need to apologise, I don't see that is excessive guilt. I think that's a very healthy guilt. I think we have to distinguish between pathological guilt and healthy guilt. And I certainly think that the guilt that most people talk about in commentaries and media isn't pathological guilt. It's not the guilt it's not the kind of guilt that they should be getting worked up about. It's very minor and it's appropriate guilt. In fact, if people did not have guilt, they would be psychopaths. So if you didn't have guilt, you wouldn't know the difference between right and wrong. And I think not knowing the difference between right and wrong is potentially that person is potentially on the way to psychopathy, because psychopaths don't know right from wrong, don't have a concept. They may have a theoretical concept, but when it actually happens, they don't experience it. So I think that is one of the myths. People go to confession because of shame. People go to confession because they are guilty about something. Guilt is an internal thing. Shame is an external thing. You feel shamed by others when shame is to do with how others see you. Guilt is to do with how you see yourself. So people don't go to confession because they're because they feel they've been shamed. They do it because they feel guilty. They feel they've been done wrong. They want to make amends, and they want to externalize it, and they go to confession. And I think that's actually healthy. So I don't buy into the argument about a confession and shame. And the other thing that atheists say is, well, people go to confession, they confess their sins, and it gives them permission to continue transgressing. One of the things about confession is that it does not give you permission to continue transgressing. You are supposed to make amends and promise not to do the same thing again, and that's actually in some of the wording that the priests use in confession during the absolution. So I don't buy into any of those. I actually had one on a slide or a paper on guilt in prisoners that I was hoping to show you, but I couldn't find it in time for when I only thought about it today. There would be a good paper to show, a good study to discuss briefly. And what it showed, that prisoners, Catholic prisoners, for serious crimes who went to confession when they were allowed out of prison had less offending than the ones who didn't go to confession for the similar crimes. It was a very interesting study, a fairly new study, but I couldn't find it to give you the exact figures. So guilt is positive because, as I've said, you can identify your transgressions, you can learn from them, and guilt versus shame. Yeah. Now, I think there is, I thought I'd brought it, I haven't, no. I have one slide where I talked about, where I showed the dynamic of what happens in confession, where you have a problem, you want to do something about it, you talk to somebody in confidence about it, you try to find ways or discuss ways of avoiding it, not doing it again, and you make amends for what you've done in some way. That's exactly the process of psychotherapy as well. So when you go for psychotherapy, you go to see a therapist, a trained person, to discuss your problems. You admit your problems. If you don't admit them, there's no point in going. You admit the problems, you discuss them, you get advice about them, and you promise to do something about them into the future. It's exactly the same process. So why, my question to the atheist is, why are you comfortable with psychotherapy but yet mock people of belief who choose to go to confession? It makes no sense, because they're both the same processes in terms of the dynamic. Anyway, finally, a study that I'm involved in, we sent it to the International Journal of Environmental and Public Health Research about 3 weeks ago. It's almost been accepted. It's on the cusp of being accepted because we got good news the other day just to make minor amendments to it. And what we found, it was a group of outpatients from 2 hospitals in Dublin suffering with depression or what's called adjustment disorder, stress disorders. And we measured their symptoms, and we examined using a schedule that only measures religious activity and attempts to separate intrinsic from extrinsic religious practice by measuring an item called salience of religion in the person's life. And we examined, so we measured symptoms, we measured religiousness, we measured the salient, the importance of religion in their personal lives, and we followed the people up for 6 months from the outset. So at the outset, we find that religion buffered so people who had bad, and these were all people who had events happen to them. We found that religious activity buffered the effects of these events on the depression. So religion helped people who were experiencing negative events. It modified the effect of the events on the symptoms, so they had fewer depressive symptoms. We controlled for a lot of variables like previous history and social support and things like that. So that was what we found. And then we found when we followed them up that in the long term the outcome was affected, as well as by usual treatment, by what's called non-organised religious activity. By that we meant prayer, personal prayer, reading sacred works, religious meditation, and intrinsic religiousness, which is, where the person personally believes in what they are doing and in the faith. So we found that those two interacted in the long term and improved the outcome. So different components of religion were impacting at different stages of the illness. And we're the first study to have shown that, so I'm very proud and excited about that study. So in conclusion, there's an increasing interest in the role of religion in health, particularly in mental health. There are positive associations overall between mental health and religion. They may be more than just associated, they may well be causal, so that we can say, yes, religion does cause an improvement in symptoms, or does cause an improvement in the long-term outcome. There's increasing evidence for biologically that when people are engaged in these religious activities, that they're actually acting biologically on the brain. Religious coping is used by many in terms of prayer, cooperating with God in finding solutions, etc. There are some myths about prayer, guilt and confession that I hope I have addressed, because when you're talking with friends you may often have to deal with them, but as I've said, they're without foundation in my opinion. Thank you very much indeed.